Good morning and welcome to this meeting of the Health and Wellbeing Board. I am Gordon Oliver, the clerk for today's meeting, and I am assisted by Kevin Griffin as the Zoom host. Before we start, I would like to explain for the benefit of members of the public who may be watching that today's meeting is being held in a hybrid format. Following the expiry of the emergency coronavirus regulations that permitted remote meetings, all of the Council's public meetings now must take place in person at a single specified geographical location, with a physical presence at that location. However, the current COVID-safe capacity of the Council chamber means that not all members of the board are able to attend physically, and so for this meeting we have a quorum of 4 members of in the Council chamber, including Councillor Graham Bridgman, Councillor Lynn Doherty, Councillor Joe Stewart and Dr. Abid Irfan from the Clinical Commissioning Group. All other board members are attending remotely. Officers presenting items on the agenda and members of the public asking questions at today's meeting will also do so remotely. The meeting is being live streamed via YouTube, so members of the public are able to follow proceedings. For the benefit of those engaging remotely, I will run through some standard Zoom reminders about how we conduct meetings via Zoom. So in addition to the points displayed on the screen, if it becomes necessary for members to telephone into the meeting, you will not be able to speak. So once everyone who has raised a Zoom hand has spoken, the chairman will ask anyone who has telephoned in to speak in order. For any votes, members in the Council chamber can take part in the formal decision. Prior to the formal decision and vote, there will be an indicative vote amongst all voting members, including those attending remotely, to give an indication to the members in the room as to the views of the total membership. If we need to adjourn the meeting for any reason, then the chairman will advise members of the revised time and date of the meeting. And if it's a short adjournment, you will be able to rejoin this meeting. Otherwise, a fresh appointment will be sent. Do members have any questions about the way in which we'll be running this meeting? No. Finally, I just need to advise you that there will be a test of the fire and lockdown alarms, which is scheduled for 10 a.m. this morning. So before we move to the first agenda item, namely the election of a chairman for this municipal year, I believe that Councillor Bridgman wishes to propose a non-notice procedural motion.
Thank you, Gordon. Well, members, everybody else, welcome to this brave new world. And for those of you looking at me on screen, I haven't been on holiday. I do not have sunburn. It's just the lighting in this room is very weird. Members, both physical and virtual, as you well know, the Council had passed a motion about the conduct of virtual meetings, but that has expired with the expiry of the regulations that Gordon's just referred to. And in this sort of limbo state that we're in between the expiry of those regulations and, well, either the 21st of June or whatever other date restrictions come to an end, we need a way of managing meetings to ensure that they are legitimate and COVID safe, but nevertheless engage other members not able to be physically present and the public. If we didn't do anything, the Constitution and the legislation between them would only permit those in the meeting room, that's the 4 of us, to speak and to vote. So Gordon's has intimated that members accessing via Zoom will be able to engage in the meeting and in an indicative vote. And to achieve that, I am proposing to the members in the room that, as necessary during this meeting, we suspend standing orders to permit, firstly, all those joining the meeting virtually, that's members of the committee, officers, and members of the public, to speak at the option of the chairman. And secondly, that members of the committee joining the meeting virtually can join in an indicative vote so that the members in the meeting room can gauge the feelings of the entire membership present on that particular item. So I am proposing that as a non-notice procedural motion.
Thank you. Does that motion find a seconder?
I'm happy to second that motion.
Thank you, Councillor Doherty. I'll now ask those in the room only to indicate if they support the motion by raising their hand. Thank you, that is carried. I can confirm that the motion has been carried, and the first item of business on today's agenda is to elect a chairman of the Health and Wellbeing Board for 2021-2022 municipal year. Are there any nominations for chairman?
I'd like to propose Councillor Graham Bridgman as chairman, please.
Thank you. And does that find a seconder?
Happy to second that.
Thank you. Are there any further nominations for the role of chairman? Nope. So we will now move to the indicative vote for all board members, including those attending remotely. Can all those in favour of electing Councillor Graham Bridgman as chairman, please raise your physical hand? And all those against, please raise your hand. And anyone abstaining, please raise your hand. Members who are in the chamber, having seen the indicative vote, can I ask you to undertake the formal vote? All those who are in favour of electing Councillor Graham Bridgman as chairman, please raise your hand. And all those against? And anyone abstaining, please raise your hand. Thank you. So that's carried, and I can declare that Councillor Graham Bridgman is elected as chairman for the 2021-2022 municipal year.
Thank you, members, for electing me as your chairman. And before I move on to the election of vice chairman, I would like to thank Councillor Howard Wollaston for his contribution as the outgoing chairman of the Health and Wellbeing Board, and indeed for his contribution to the work of the council as portfolio holder in this arena. That's a role I took over in March. I'd also like to thank Dr. Bal Bahia for his sterling service as vice chairman of this board and being chairman of the board's steering group. Councillor Wollaston recognised Bal's contribution back in March but that was an informal meeting, and I would like to echo those words publicly, and indeed to welcome Dr. Abad Irfan to the board in Bal's stead. Members, could you please ensure you're muted? Thank you, Councillor Jeffrey. Further, just to explain to members of the public watching the constraints on who is chairman and vice chairman of this board. The terms of reference for this board establish that a representative of the council, and that is generally the portfolio holder with responsibility for health and wellbeing, and that's me, it chairs the board, and that a representative of the Berkshire West Clinical Commissioning Group is vice chairman. And one of those representatives is the aforementioned Dr. Irfan. So I have the greatest of pleasure in nominating Dr. Abid Irfan as vice chairman of the Health and Wellbeing Board for the 2021-22 municipal year. And I'd look for a seconder.
Happy to second that, Chairman.
Councillor Doherty, thank you. Are there any other nominations? No. So we'll now move on to an indicative vote of all board members, including those attending remotely. Can those in favour of electing Dr. Abid Irfan as vice chairman, please raise your physical hand. Thank you, members. Now, members in the chamber, having seen the indicative vote, can all of those in favour of electing Dr. Irfan as vice chairman, please raise your hand. And against and abstaining. Thank you. Gordon.
So I can declare that Dr. Abid Irfan is elected as vice chairman for the 2021-2022 municipal year.
Thank you, members. Gordon, do we have any apologies for this meeting?
Yes, Chairman. We've received apologies from Charlotte Hall from the Corn Exchange, and Jessica Jundu Evans is substituting, from Dom Hardy of Royal Berkshire Foundation Trust, from Reva Stewart from the Berkshire Healthcare Foundation Trust, and from Councillor Martha Vickers, and Councillor Owen Jeffrey is substituting.
Thank you. Right. Members, we now move on to the minutes of the last meeting, which will be in your virtual or physical pack, depending on what you've got. I have one proposed amendment from the chair, and then I'll look to see if there are any others. I noted that in the meeting of the 28th of January, Bal Bahia is listed as giving his apologies, but he's also listed as giving a declaration of interest. I suspect the declaration of interest point was simply the stock declaration of interest that we have on the table, as it were, and listed for that purpose. So I think we just remove him from the declarations of interest. Members, both physical and virtual, does anyone else, members virtual, I'd ask you to raise your Zoom hand, because it's a lot easier for me to see that than if you raise your physical hand. So let me start with Councillor Stewart.
Thank you, Chairman. A small change. I was actually in attendance at the last meeting, but I haven't been included in the list of attendees.
I'm sure we can sort that one out. Gordon? Anyone else? I see no further hands, so let us move on to adoption, and I will simply deal with that, given that we've gone through the minutes and made sure there are no amendments in the room. So I'm going to propose from the chair that we adopt the minutes as a correct record of the last public health meeting of the Health and Wellbeing Board held on the 28th of January 2021. Can I see if there's a seconder for that? Oh, I've got two, that's fine. Dr. Stewart, Councillor Stewart, apologies. And let's have a vote of those who were actually in the meeting at the time. The three of us, we all say yay, so there you go. Right, those, and I will sign those after the meeting, Gordon. Right, actions arising, members. There, I think, were four. Gordon, before I get on to the four, could I just ask that when we publish the actions arising from previous meeting, in the comments, because we might have more than one comment and it's also useful, could we date those comments so that we've got some context of where we are in terms of response? The first action was at Thatcham Research and Andrew Sharp. Andrew, have you made any progress?
I've spoken with them again, and this is basically with their board. So I think it's going to take possibly Gordon and myself just to give one last chase to see if this is going to actually be something they're going to be able to do or not, because I think one of the problems is if they're struggling with this decision, you sort of start thinking, well, is actually attending meetings going to be a problem for them as well? So although I think they'd be a great addition to the board, it's about being able to turn up as well. So I will chase them up for you. Thank you.
Thank you for that. The next item is 153, which is the Health and Wellbeing peer review, and that is going to be progressed next year, I believe. So I think that one's will be on a future agenda. The next one is the Cultural Heritage Strategy Delivery Report, and that is coming, as you can see from the comments, coming to the meeting in July. And finally, the dashboard, that's one for Matt, I think. Matt?
Yeah, thank you, Chair. So I think that dashboard is still being developed. There's actually a plan to make that publicly available, and as part of the Berkshire Public Health Dashboard. So that will include a range of different indicators that will enable us to monitor the impact of the pandemic, both direct and indirect consequences. So that's still in development. I don't have a timeline, but I'm hoping probably within the next maybe 4 to 6 weeks that will go live. But I'm happy to keep the board updated.
Thank you, Matt, and look forward to that. Any questions on anything? I see no hands. Right, so we now move on to declarations of interest. Now, obviously, there are standing declarations of interest for this board, so that we don't have to, because otherwise we'd have to repeat them at every meeting. So if anyone who's a member of the board thinks they have a declaration that they would have to make at every meeting, can you advise Gordon so it's in the list? Other than the standing declarations, does anyone have a declaration to make? No, excellent, thank you. Let's move on then. So we now have the public questions. Firstly, let me thank members of the public who have submitted questions to today's meeting. We've received 5 questions. 4 have been submitted by Paula Saunderson and 1 by Paul Morgan, and I'm going to ask Kevin to bring them both into the meeting. So both Paula and Paul have elected to attend today's meeting remotely. And for each question, in the sort of tradition of virtual meetings, we will display the question on the screen and not have to read it out. And I will then ask the appropriate board member or person to respond and answer. And then the individual will have an opportunity to answer a supplementary. But can I remind them that this must only be to clarify the response that they have received and not to introduce any new business. So, as permitted by the Constitution, and unlike the way in which we sometimes handle these questions, I'm going to take all of Ms. Saunderson's questions sequentially, and then we'll deal with Paul Morgan's afterwards. And that is on the basis that it won't take us 30 minutes. to deal with the questions because that is the time limit. And if we did hit the 30 minutes, we would supply the question, the response to the question in writing within 5 clear working days. Not, as I say, I think we will hit that barrier. So, Gordon, can we move to question A? Fine, and that I think is going to be answered by Nikki Cartwright of the CCG, who is the Interim Director of Joint Commissioning. Nikki.
Thank you very much, Chairman. In response to the question, the 3 local authorities and the Berkshire West Clinical Commissioning Group have agreed to undertake a review of continuing healthcare and its local application with a view to harmonising this across the Berkshire West footprint and to understand the reasons for the awarding of eligibility. And we anticipate that to be completed within 6 months.
And Paula, do you have a supplementary?
No, that's fine. Thank you very much. I look forward to hearing the outcome of the work.
Thanks,
Right.
Paula.
So we'll now move on to question B, and I am going to answer that one myself. And the answer is that I think, as Paula knows, this board doesn't undertake scrutiny. And so the question is one for Overview and Scrutiny Management Commission. But, as again, I think Paula knows, they don't take public questions. So I fully understand why the question has been asked here. So I have been in touch with both the chairman of the commission and the chairman of the Health Scrutiny Committee. The OSMC has asked for a report to come to a future meeting, which will seek to highlight lessons learned from the pandemic and the changes that have been put in place as a consequence. I'm told that this will address matters relating to health and adult social care, as well as the wider impacts. Subject to the contents of the initial report, OSMC may then seek to undertake more detailed and in-depth reviews on key aspects of that pandemic response. OSMC is responsible for setting its own work programme across all council services. And whilst members of the public may not ask questions, they are able to suggest topics for future reviews via the council's website. So I'd encourage anyone to do that if they think there is a topic that OSMC should be looking at. And Paula, I will ensure that you are sent the relevant link so that if you wanted to raise it there, knowing what I've just said about them going to be doing some work anyway, you can. Do you have a supplementary? Paula, that was to you. Do you have a supplementary? No, she's still got 2 more after this, Kevin. Thank you. Paula, apologies for that. There was a misunderstanding with the Zoom host about when your questions were finished. Do you have a
Right, sorry. No, that's fine. Thank you very much for that clarity. Thank you.
Thank you. Now, questions C and D were allocated to Councillor Stewart as portfolio holder for adult social care, but are actually going to be answered by Andy Sharp, who is the Council's Strategic Director of People. So we'll start with question C and over to Andy.
Thank you, Chair, and thank you for your question, Paula. Just to clarify before I answer the question in more detail, Willow's Edge actually hasn't been closed. Willow's Edge remains open. It's Walnut Close Care Home that's recently been closed. Walnut Close didn't have any nursing care beds within its offer, so the number of nursing beds that are available in the market haven't changed as a result of the closure of Walnut. It's also, I guess, important to note that because of the pandemic and the impact of that pandemic on the local market and the population, very sadly, the pressure on the care market has changed, and the number of beds available has changed as well. So there is more supply than demand in the market currently. So there are more beds available than spaces that we would need to fill at this point in time. It is truly fair to say that if you look towards the west of where we are, then we'll find that the prices are less expensive. But if you move towards London, prices become more expensive. So the prices within West Berkshire are generally reflective of market forces the general prices of property in the local area, and therefore people's ability, in theory, to pay for those places we may wish to purchase in the market, or that we would purchase for them in the market. We do monitor provision of beds in the marketplace very, very closely. We have a responsibility to seek to manage that market, which is something that we do as part of our work with the marketplace, to try and make sure there is the right spread of beds available and that the prices of those beds are affordable across the market.
Thank you. Paula, do you have a supplementary for Andy?
Well, I've never managed to find any market information, and for the whole market, for self-finders, self-funders, there's quite a few of us out there that aren't actually under the radar of adult social care. So could I ask you to just look at where we might find that information if we're not coming through adult social care, please?
Certainly, there is information available on our website, and we've published a market position statement which talks about the shape of the current market and the availability of bed space in the market. So I can certainly make sure that you get a copy of the links for that, so you can access that.
I have seen that market position statement, but I'm more talking about current positions.
Okay, as I say, there is information on the website, but
Okay,
I'm happy to speak to you outside this forum if that's helpful.
Yeah.
Can I suggest that's taken offline?
Absolutely.
So we will now move to question D, and again, this is for Andy to answer.
Again, thank you for your challenge. For the question, sorry, we would agree that there is a challenge with access to respite beds and places. That's been exacerbated to some extent by the pandemic. It's been a long-term issue. We do work with our colleagues in the commissioning team within the council to work with the market to identify available beds and activity that can support people through respite. The location of permanent beds is an important factor, and we need to make sure that that's available in a way that supports family members to provide access to those people who have respite requirements. We do need to make sure we work with the market, we accept that, and there is ongoing pieces of work across the council with our adult social care services and our commissioning team to try and grow the respite offer. But we do recognise that is a challenge at the moment, but it is something that we're working on to try and improve the position.
And do you have a supplementary one?
Well, again, I would ask that you try and make that available in a forum where self-finders, self-funders can find the information. Maybe by the new dementia awareness website. It's been underutilised for actual dementia carers. There's key information that could be included on that website that is missing.
Okay, thank you for that. We do provide information on our website again, but we can make sure that we take on board your comments, and I'll make sure that the service is aware of the feedback you provided. Thank you for your question.
Thank you.
Thank you, Paula, and thank you for attending. I'll now move to the final question, which is from Paul Morgan, question E, and I am going to answer this one. Well, what I would say is that, strictly speaking, apart from some element of the meetings budget in order to actually run, and the administration budget to run the Health and Wellbeing Board, the Health and Wellbeing Board doesn't have a direct budget or direct control over budgets. Instead, what happens is that board members will undertake to make use of funds that are available to their organisations to deliver agreed priorities set out in the joint strategy, and we'll be coming onto that later in the meeting. There is an exception to that general position, which is that there is a thing called the Health and Wellbeing Priority Fund, and that had an initial sum of £96,000 put into it in 2018 to support projects that are managed by the Health and Wellbeing Board subgroups. Now, that money has been used to support projects that support our priorities and address health inequalities. Projects must have a demonstrable impact, and we encourage match funding where we can achieve it. So projects that have recently been funded or which are ongoing include thinking together events, suicide prevention outreach, life skill workshops, and health and wellbeing engagement. There's just under £33,000 left in the pot, and that is intended to be used for additional projects over the next 2 years. Paul, do you have a supplementary?
No, thank you.
Thank you. Then thank you for attending. Thank you for your question. And we'll move on with the rest of the meeting. So, Gordon, do we have any petitions?
No petitions received, Chairman.
Thank you. So we now move on to the first substantive item of the meeting, which is the Joint Health and Wellbeing Strategy Update. And I'm going to invite Sarah to present the draft, and then I'll turn to members. However, I do want to point out before we move, and I'll take a vote on this at the end, that you've had a secondary report which has amended the recommendation, and we are now going to be looking to a 6-week public consultation. I'll speak more about that when we get to the point, but I'm going to let Sarah speak. Sarah.
Thank you, Chair. Thank you, Board, for having me. I'd like to present to the Board the first draft of the Berkshire West Health and Wellbeing Strategy for your consideration and comment. As the Board is aware, the strategy has been in development since March of 2020. It's taken a 4-phase approach, starting with defining the current state, a series of prioritisation workshops held with stakeholders last summer, and then an extensive piece of public engagement which we use to refine these into the final 5 priorities that are included in the strategy. The strategy has 8 principles running throughout. These are recovery from COVID-19, engagement, prevention, empowerment and self-care, digital enablement, social cohesion, integration and continuous learning. The strategy consists of 5 priorities, and these are as follows: to reduce the differences in health between different groups of people, to support individuals at high risk of bad health outcomes to live healthy lives, to help children and families in their early years, to promote good mental health and wellbeing for all children and young people, and to promote good mental health and wellbeing for all adults. We're looking for feedback today from the Board, and the strategy is also being taken to Reading and Woking Health and Wellbeing boards for a similar review. And we will continue to revise the strategy content based on this over the coming months. As just mentioned, at the steering group recently, we discussed whether to go ahead with a public consultation period or whether instead to use public engagement as a key part of development of delivery plans. We have since consulted with our legal team, and the conclusion with them is that a formal public consultation period of 6 weeks is required. So we now propose that this should take place over June and July. And during that time, we'll also continue to use stakeholder engagement as we move into the development of delivery plans and shaping local actions in order to implement this strategy. Thank you.
Thank you, Sarah. Right, I'm going to turn this over to the members to see whether anyone has any questions or comments to make on what Sarah's just presented. But no, Councillor Doherty.
Thanks, Sarah, and thanks for all the work that's been done on this. It's good to see it coming together. I suppose just one question from me, which is the priorities 4 and 5 around good mental health for both children, young people, and for all adults. And we've always talked about this cradle to grave, where we should have sort of a seamless joint up approach. I just sort of, your thoughts around whether by separating those 2 priorities out, will they actually be worked together in conjunction with one another so that it is that seamless approach? Because that's always been the concern, that they're treated very differently rather than coming together. Just your thoughts on how we can ensure that that happens going forward.
Thank you, and I think that's a valid point. And I think we have discussed, and we did contemplate using it as a sort of good mental health and wellbeing for the life course. I think it was felt that we wanted to keep them separately to ensure that children's mental health and wellbeing wasn't lost within the wider picture, but also because the delivery and action plans are likely to sit with different groups at the moment. But I think it's, as you say, I think it's important to ensure there is that transition and that it's an ongoing process between the 2. And that's certainly something I can look back at the text that we include and ensure that that is highlighted, because I think that probably isn't emphasised at the moment in the strategy. So thank you.
Councillor Burke.
Thank you, Chairman. Thank you, Sarah. Yes, I think it's a great piece of work that we've done here. I welcome the emphasis on children and young people, and I'm very pleased to see the extent to which it's already been, or stakeholders have already been engaged in the development of this. I guess as a body of work, it's excellent. My question is around how are we going to communicate this strategy to the wider public? Because I don't think that this document is it does a great job of that. It speaks to professionals, it speaks to members, but it won't speak to even the people who participated in the engagement, with 46 reference bullets in it, with each of which has a link to a website or document somewhere else. It can't be used by in a paper format. So just some thoughts around that, please.
No, absolutely, no, thank you. And I think as we now move into sort of thinking about how the strategy will be implemented, I think our plan is always to keep engagement with the public and keeping them involved with it. I agree that the strategy in its current form is perhaps not as accessible to the public as it could have been, and I think that's something that we need to think about as we start to speak to them around thinking about what this actually means for the public. At the moment it's quite a high level and doesn't really talk about the actions, but those will be included within the delivery plans, and the intention is that engagement with the public will become an ongoing thing rather than a discrete piece of work that we've done for this. We want to sort of take them along with us, and hopefully that will get it out there and help people to understand it a bit more.
Thank you, Sarah.
And Councillor Jeffrey, you're muted.
Now I think I'm not muted. Thank you. Sarah, thank you very much indeed. Can I just ask you, and because I'm only a substitute, this may be something that's already been explained to the board, in which case I apologise, but just how was the prioritisation developed? You know, what were the principles that you were working to decide which one was going to be where, and which ones were going to be selected in total?
Sure. So sort of in brief, we started by looking at the existing strategies, the impact that they'd had. We looked at the data, looking at population need. That gave us, and we spoke to stakeholders about what they felt the population needed. That gave us a really long list. We then used stakeholder engagement last summer, a series of workshops to get that down to a shorter list of about 11. And then we went out to the public over about a 4-month period and asked them what they felt were important to them, what would make a difference to their lives. And through that engagement, we got down to our final 5. They're not in order, as it were. I know they're numbered 1 to 5, but that's not necessarily in order of importance. However, we do recognise that given that health inequality sits across everything, then while that is a priority in its own right, it also underpins all the other priorities as well. So I suppose that kind of puts that as number 1, but otherwise they're not in order of importance, as it were, within the strategy.
Thank you very much indeed, Sarah. So literally, those 5 are all seen as equally important. It's not that one is above the other, and it was the public that ultimately brought the long list down to the short list.
Yes, exactly that.
Thank you.
And Matt.
Yeah, thanks, Chairman. It's just going back to Councillor Berwick's point around engagement, and obviously later on in the agenda we have an engaging and enabling paper, and I think that will kind of help set out how the local authority want to work with our partners and engage with our communities, and I think that will provide a real opportunity to embed that kind of engagement principle that Sarah was talking about. And we also have an engagement group that sits under the Health and Wellbeing Steering Group, so I'd imagine they'd be tasked with how we actually communicate and engage with our communities as part of the delivery of that strategy. You're on mute, Chairman.
You're on mute.
I honestly, ladies and gentlemen, I pressed the button and assumed it had gone green, and it hadn't, so I apologise for that. As I was going to say, Sarah has said that there is a theme here, and I was going to say that I absolutely agree that there is a theme running through a number of these papers, starting here. And indeed, if we look at the overall results of the ranking of priorities on page 93 of the physical pack, I don't know what page it is on anything else, it's to reduce differences in health between different groups of people. In other words, addressing health inequalities. And there is a health inequalities theme running through the next couple of papers as well. So it's just a comment that we do have a theme through to the Marmot review and then through to the strategy and everything else coming out of the back end of it. So let us see how that works. However, let us now move on to 2 votes. So the first vote, and we'll start with the indicative vote, is to adopt an amendment, because of course the pack that came out, the public pack, contained the original report and the original recommendations. So there is a proposal to agree an amended recommendation. That is this: for the board to support the proposal for a 6-week public consultation on the draft strategy, along with further stakeholder engagement as part of developing the local delivery plans, which will be used to implement this strategy in West Berkshire. I will propose that from the chair. Let me seek a seconder. Councillor Doxey, thank you. And let me now turn to the entire membership for an indicative vote by raising your hand if you agree. And is there anyone opposing that? And are there any abstentions? 1 abstention from Andrew. Thank you, Andrew. So that is adopted as an amended proposal, and we will now seek to agree that. So again, I will propose that amended recommendation from the chair. Does it find a seconder? Again, Councillor Doherty, thank you very much. And further indicative vote of the membership. In favour? And against? And abstaining? Andy, you are a member of this board. Did you vote?
I did, yes, I voted for.
I missed your hand. I was looking to see whether you were voting. Okay, members, thank you. That is adopted. The recommendation has been approved. Sorry, I do apologise. I need to move to a vote in the room. So vote in the room for, I'm going to take both the recommendation to amend and then the recommendation to approve. So to amend, unanimous, and to approve. Surprise, surprise, unanimous again. Thank you, members. We have an adopted proposal. So we now move on to the next item on the agenda, which, as I say, continues a theme of addressing health inequalities and is the Build Back Fairer COVID-19 Marmot review. Now, this is an item for discussion only. There won't be a vote at the end, and I'm going to invite Sarah to provide a summary and speak to the report. Thank you. Sarah.
Thank you, Chair. And yes, thank you. So I'm just going to briefly summarise the paper that has been presented to the board. So this paper summarises the report that was produced by the Institute of Health Equity, and it's the COVID-19 Marmot Review, and it was published in December of 2020. Immediately prior to the COVID-19, the Marmot Review 10 years on had reported that the increase in life expectancy had stalled with increasing social and economic inequalities. We know that health is closely linked to social determinants, and the conditions that people are born, grow, live, work and age all have an impact beyond that of healthcare itself. The Build Back Better report itself has highlighted that the inequalities in social and economic conditions before the pandemic have contributed to the high and unequal death toll from COVID-19. Mortality rates have been particularly high among Black, Bangladeshi, Pakistani and Indian communities, and most of this is thought to be due to deprivation rather than being explained by pre-existing health conditions. And these factors are confounded by long-standing inequalities and structural racism. The report particularly highlights specific groups who've been disproportionately impacted by the pandemic and divides recommendations into a number of groups. And it includes recommendations to reduce the inequalities in mortality from COVID-19, to reduce the impact on early years and inequalities in education, to improve outcomes for children and young people, to create fairer employment and good work for all, to ensure a healthy standard of living for all, to create and develop healthy and sustainable places and communities, and to strengthen the role and impact of health prevention. And for each of these, the recommendations are divided into short, medium and long term. A number of these recommendations are high level and require action at the national level. However, they also do highlight a need to put both a commitment to social justice and also to put equity at the heart of local decision making. The report is presented today to provide an opportunity for discussion on how the recommendations could be implemented locally and used to help inform recovery planning. Thank you.
Right, I'll now invite members to ask any questions or speak to what Sarah has just said. Let me start with Dr. Irfan.
Thanks, Sarah, and thanks, Chairman. Yeah, I mean, I think the report is an excellent kind of critique of what's happened and the differential impact on our communities, and especially the BAME community and others disadvantaged. So lots of recommendations, some clearly for government and national policy, but interspersing between those, quite a few things I think we can pick up, and as Graham's already outlined, there's a significant theme of the impact of COVID and inequalities, which is picked up in the next paper as well. So looking forward to kind of thinking about the actions we can take and build those in through all the various kind of groups, the strategy, the health and qualities task group. There's something going on at the place-based as well for wide across Berkshire West with all the organisations. So I think there's significant work to do, and I think if we can kind of hit even 50-60% of these, then we can have a significant impact on certainly those communities, and working together across all our kind of organisations and different boards.
Thank you. And Councillor Doherty.
Thanks. It's a really useful report. I agree with Dr. Irfan. It's going to be really interesting to see how we go down from the national picture to the local picture. There's a lot going on here in West Berkshire. We've already got our recovery and renewal plan in place, and one of the primary areas is recovery of the health of our public and our residents. So I think we need to make sure that some of the local stuff comes into that work that's currently been done through the recovery and renewal plans. So I think that'd be a really good platform. We also need to recognise that some of the stuff in the report won't necessarily be have the same significance here in West Berkshire as it might in other places. And I just highlighted, it was quite interesting reading through 5.12, and it talks about housing is the key determinant of health, and overcrowding housing has emerged as a high risk factor. Don't disagree with that at all in any way, shape or form. It talks about in March 2020, funding was provided to local authorities to provide accommodation to those sleeping rough. Again, we've seen that, and we know the work that's been undergone by a partnership across West Berkshire here. It then goes on to say, however, since then, there's been increases in rough sleeping and homelessness. And actually that has not been the case here in West Berkshire. We've been actually working at really getting those rough sleeping numbers down. So I think we need to look at the report and look at it in context of West Berkshire and what pieces from the report we really need to focus on. So that might be something for yourself, Chairman, and some of your subgroups to really drill down on the data for West Berkshire against this report.
Yeah, I mean, I suspect that as well as when we're coming on to the next paper, to the Health Inequalities Task Force, and we'll debate that in a moment, but there will be work here for all sorts of bits of the infrastructure of health and wellbeing, if I can put it, both within the council and within the various bodies that sit underneath the Health and Wellbeing Board. And it will work its way through. What we need to make sure, and I'm sure between us, Matt and I and Sarah will ensure that, is that all of the bits are picked up somewhere. Someone is dealing with all of the aspects of this report. So as I say, if there are no more questions or comments, and I see no more hands, that was a report to note, and therefore we are going to move on to the next item, which is, this is the Sarah Rayfield show, the next item from Sarah, which is the Health Inequalities Task Force, and I'm going to ask Sarah to present.
Thank you, Chair. Yes, this is the last report from me today. So this is a paper on the new Health Inequalities Task Force that we've recently established. The aim of the task force is to build on the early work on reducing health inequalities that did start locally pre-COVID, but also now taking into account the impact of COVID on increasing health inequalities, and in particular the Build Back Better report, as we've just discussed. Reducing the differences in health between different groups of people is a priority within the new draft strategy for Berkshire West. And as I've mentioned, it also acts as a pillar sitting underneath the other 4 priorities. During the engagement period, it was really clear that reducing health inequalities was felt to be vital to the future work of the Health and Wellbeing Board. In response to this, we've recently set up the Health Inequalities Task Force, and this includes our present officers from across West Berkshire Council. The membership includes public health, education, equality and diversity, building communities together, adult social care, children's services, transport, housing and planning, and also Berkshire West CCG. The purpose of the task force is to provide a coordinated approach to the work undertaken to address health inequalities in West Berkshire. And it's proposed that the Health Inequalities Task Force should be responsible for developing the delivery and action plan to address the first priority for the new health and wellbeing strategy. This will be done initially by doing a deep dive into local data to fully understand our inequalities, mapping out the current work that's in place and initiatives that are already ongoing, but then also working with our communities and partners to understand our local picture, building on the engagement that's already taken place. And we will also be using evidence to understand what works. We're looking to support a health and all policies approach across the council as well. Our proposal today is that the Health Inequalities Task Force should be formalised as a new subgroup of the Health and Wellbeing Board and so reporting to the board via the steering group. Thank you.
And thank you. I have one comment, which is certainly no criticism at all of anything that's in the report, but simply to say that when we, and I've got no issue with the way in which the terms of reference are set out at the moment, I simply say, and I think other members will know this because I think I said this at the informal meeting we had, that there is a piece of work coming down the council at the moment to look at the constitution and look at the way in which committees and subcommittees and task groups and are formed, more to the point to make sure that we have some consistency across how we describe those bodies, so that terms of reference will start to have a format, have a formula, so that they, there will be an order, the membership and then the terms of reference and any legal powers and so on and so forth. So as we come to them, we will seek to bring things into line, not to change the word, not to change the emphasis, but simply get them all singing from a similar hymn sheet. So that's my one comment on this, except other than to thank you for on this and the previous piece and the previous piece, to thank you for the huge amount of work that you've put in. This has been, I can assure members that if you don't realise it from reading the papers, this has been a mammoth task, and Sarah has been front and centre in this work. So I thank her for that. Members, do you have any questions regarding the title? Well, hands in the room, and currently no virtual hands. So I'll start with hands in the room. Abid. No, go on. I'm chairman. I'm calling you.
Thank you, Chair. It was just really a quick question for Sarah on linking up with the ICP kind of prevention and health, newly termed Prevention and Health Inequalities Board. So I know that's been, I'm not sure who chairs it. I think it might be Katie, and you may already be plugged into it, but they, as you know, are doing quite a bit of work on looking at this, and there's a whole program, and they've got a couple of themes. So looking at kind of inclusive restoration of NHS kind of services, looking at population health data and seeing those kind of communities which may perhaps at risk of being left behind in the recovery, mitigating against digital exclusion, big focus and push on ethnicity recording, and certainly our GP systems have been upgraded to have alerts on now when, as soon as you kind of open up in a patient consultation, to say if it's not already recorded, record ethnicity and taking account of that. I think the vaccination program has been doing that as well. Whether the two are joined up, I don't know, but certainly in primary care. And as I said, kind of looking at all the kind of prevention programs, but with specific focus on those at-risk communities, those hard-to-reach communities, and so forth. So lots going on there. It was just making sure how does that link in, so we're not duplicating some of that. Thank you.
Yeah, no, absolutely. Thank you. We hadn't linked in so far, but I certainly can make those connections with Katie, and I think that sounds really sensible. So thank you.
And Councillor Stewart.
Thank you, Chairman. It wasn't a question particularly, it was just to say, as you said earlier, with the number of papers that we're talking about here that Sarah has, and others I'm sure pulled together, that it makes absolute sense to have this this task force. The membership looks absolutely bang on, because we need to make sure that we're covering all aspects, and that the experts in those areas are being included in those conversations. And I particularly like the fact that we will have a health in all policies approach at the council. That's something that, with my mental health champion role, I'm certainly trying to do in every meeting that I attend, in every conversation I attend. And I think we should be doing the same with health as well. So in fact, this may be jumping the gun, but I'd be very happy to second the report when it comes to it.
Well, that's saved me one task for looking for someone. Okay, Matt.
Yeah, just to echo, thanks to Sarah for all these reports. I think they're really, really helpful. I think there's a few points really for me. I think this does build on some previous work that's been undertaken. I know Councillor Jones is on the call as well in working with members and understanding what the needs of local communities are. I think the point for me is this is incredibly complex and this will take time. And also this group in itself won't be able to address health inequalities. I think it has to enable that and facilitate that across the whole of the Health and Wellbeing Board, working closely with the NHS, as Dr. Ifan has said. So I think I think it just epitomises all that we need to do, but make sure we collectively work together to tackle this, understand that needs. And again, it links back to the engaging and enabling local communities as well. We have to work with our communities, understanding the assets, understanding their needs, so we can really address those inequalities once they've been identified. So yeah, that's what I wanted to say. Thanks.
And Andy.
Thank you. It's not a dissimilar comment to that made by others, really. I think there's a lot of work to do around this, and there's a lot of activity already taking place. And one of the things that's referenced in the report is the fact that it's almost a place leadership role, and the fact that we've got to influence other partners, but the membership of the task force is relatively tight. So I guess it's just understanding how that's going to impact on other things that we do, how we'll engage with other partners. Education, for example, obviously we have an internal service, but it's engaging with schools and other partners. So as this evolves, it will be good to see how that's going to work and how that will operate to make sure that we take on board all of those issues across the sector. But very supportive of the report, really well articulated. Thank you for that, Sarah.
And thank you, members. I don't think anyone else wants to speak to this, so we will move on to the proposal. And the recommendation is that the Health and Wellbeing Board formalises the new Health and Inequalities Task Force and agrees the task force reporting into the board via the steering group. I will propose that from the chair. I think we've already identified it, find a seconder in Councillor Stewart. So I'll now look to the entire membership for an indicative vote. In favour? Thank you. And against? And abstentions? Thank you, Andrew. And so I'll now, with that in mind, hold a meeting vote of the four of us. Members in favour? Unanimous. Thank you. That recommendation's been approved. We will now move on to item 12 on the agenda, which is the Health Watch COVID Patient Experience Survey Report. Before I ask Andrew to present, members should be aware, hopefully, that there was a response circulated on Tuesday, and that will have been emailed out to everyone. Andrew, over to you.
Thank you, Mr. Chairman, and thank you, members of the board. The first thing I wanted to do with the report, because one of the challenges we have with health and well-being is the length of time in between meetings. So from a contextual point of view, the survey that the report talks about was held between May and August of last year. Most of the report deals with the first wave, anecdotal evidence as we came out, but doesn't really touch on the effects of the second wave, the second lockdown, or anything like that. So it was completed before any of that sort of happened. And equally, one of the challenges we faced was for most of the period of time, we weren't able to actually get out and meet people in public. So we had to do things online. That obviously excluded lots of people who can't take part online, which is a challenge. But we still managed to get the highest number of survey responses of any of the health watches across our patch. So although the numbers aren't huge, public testimony in this sort of condition really matters. So effectively, what's been our biggest health crisis in 100 years had the full mix of responses, and we hope the report reflects this. So we noted that there were more compliments than complaints from all the free texts we received. It detailed some heroic actions from various bodies, various people, but it also did highlight some disappointing outcomes in the first wave. And I think some of it is possibly to be expected because no one had a handbook of a pandemic like this. No one had been through it, no one knew where, and even still, we're still learning as we go. But I think the one thing that has sort of struck me in terms of the response, and I just want to thank especially all the people who have responded, and that's included Health Watch England, Sir Simon Stevens' office, Health Education England, Public Health England, Thames Valley Local Enterprise Partnership, West Berkshire Council. I'm expecting a response from the Bob ICS or the Berkshire West ICP. We just haven't had that as yet, and there's one or two others we're expecting through, so thank you for that. But one of the things that I just wanted to highlight in all of this, in terms of, while there is lots of elements of success, we've also got to look at the fact that there are 240 plus families who were bereaved by COVID within West Berkshire. They include healthcare workers as well, who put themselves at great risk, which is more than entire countries in certain parts of the world like New Zealand, Vietnam, Taiwan, Gambia. So while we should rightly be praising ourselves, we should equally be saying, was there anything additionally we could do? And what we hope to do is bring this public testimony to the board to look at this, and also to actually start a conversation. This report is not meant to be a finished piece. It's meant to be the start of a conversation. And one of the things I wanted to highlight was the difference you find in how health and social care reacts to issues and incidents. And even last night, we had the Panorama program about patient safety. We had the National Audit Office report earlier in the week about COVID with various failings highlighted there, and even the CQC report in our own system about Huntercombe. And things keep repeating. We don't get to the end of it. Whereas you look at the aviation industry, it's now safer to go on a plane than it is to drive a car. And it's because they're using an open loop learning system. And I'm afraid it looks like health is still using closed loop systems. So instead of actually seeking to say, can we improve, where did things go wrong, we end up with too much time spent on deflection, on semantics, on unfair comparisons, and effectively not just getting to the hub of things, and often creating false narratives. So we hope that this would create a platform for West Berkshires to have a COVID pandemic learning, either a document, a forum, a task and finish group. And I think what it has done is it's highlighted weaknesses in system integration and ability of some partners to be transparent and both give and receive feedback within an emergency situation. So I think those are really, really important. And I think, if we don't learn from this, as was famously said, those who fail to learn from history are condemned to repeat it. Should we be faced with this again, more lives may be lost that don't necessarily need to. So it should be an opportunity to start the conversation, not silence it. And effectively, the challenge for us is to truly integrate the system, so we don't end up with people saying oral health in West Berkshire is nothing to do with us. What is the difference between oral health, mental health, or physical health? The fact it's commissioned differently shouldn't matter. So if dental is failing, if phlebotomy is failing, or it is all the responsibility of the board members, a bit like Marmot says with the make every contact count. So we see the report very much as a starting point, not an end point. And equally, there will be far more to be learned once we genuinely get through the second wave, the vaccination program, and who knows, hopefully COVID actually receding. But what we shouldn't do is just go back to normal and count this COVID pandemic as a one-off. That's what closed loop systems do, and it's really damaging. So that's all I really wanted to say in terms of the report, because I think there's lots in there, and I know people have read it and it's been updated. So happy to take any questions. Thank you.
Thank you, Andrew. And I should, I missed a chat, so I apologise for this. And I apologise to Zahid Aziz, who is in by phone. So Zahid, if at any point you have anything you want to raise, please just speak and we'll pause and bring you in, rather than going through that rather convoluted exercise of asking whether anyone who's telephoned in wants to speak at every point in the meeting. So members, does anyone want to speak to this item, or are you all cowed into submission by what Andrew's just said? Sharon.
Thank you, Chairman. And you know, as I've reflected back to Andrew, we really welcome this report, and it's got very good insights in there around the elements of learning from looking at wave one and then wave two COVID and future lessons, particularly for the NHS and integration. Apologies, our response is on winging its way to you, Andrew. You're actually going to get it hopefully in the next day or so. We've got some changes in our health system, so apologies, it's a bit slower than our usual response, but you will get that. I just wanted to pick up a couple of points from Andrew's report, and as he said, it was done early in wave one, and even with wave one, there were lots of lessons learned by the NHS system around how we approach wave two. And some of those elements that were started in wave one was around the points Andrew has made around integration. So we had weekly health and social care meetings during the first wave of the pandemic to ensure that we were collaborating and sharing challenges around care homes, surge capacity, primary care, urgent care, PPE and safeguarding. I'm not saying we've got it right, but there was that will to get everybody in the room on a weekly basis to try and move some of this over. Some of our meetings that we have that are integrated in the Integrated Care Partnership may not have occurred, but shorter sessions were held to again relate and share challenges and escalate issues as appropriate. And I know people will understand this, but I think I need to reiterate that quite a lot of the health challenges around service delivery was based on social distancing measures and the extra requirements for infection control because of because of COVID and managing aerosol generating procedures. However, some of the services that Andrew's mentioned and are in the report around phlebotomy, memory clinic, they have now either gone back to pre-COVID levels or they are providing a mix of remote and face-to-face assessments. And one of the key things I think I need to point out as well is the NHS is very keen around the decompression of staff going through the different ways, which was again in the response, and the way a lot of things have been expedited in building that relationship for integration and moving forward. And Andrew, you're absolutely right. We need to keep learning those lessons, and this is not a one-off closed piece. We will keep learning and moving forward for this. So I welcome sort of working with partners around moving these elements forward as well. Thank you.
Thanks, Sheraz. And Councillor Owen.
Thank you, Chairman. Really, it's just a very brief point indeed, and it is to just reinforce what Andrew has just said to us, that there must not be going back to normal. We've got to have that open loop. We have got to take the lessons aboard ongoing for years to come as to how we actually provide these various services, because nobody knows when we're next going to get something like this, and we have to be very, very open-minded indeed. And my personal thanks and thanks from this side of the community to Andrew for the piece of work that's been done.
Thank you, Owen. And the other A sharp, were your parents both musicians? Anyway, go on, Andy.
Definitely not musicians. Thank you for the report, Andrew. I think it's really helpful. It does highlight some really key information, some key learning. I think my only comment would be that it would be really helpful to understand how people's perceptions have changed through waves 2 and waves 3, because I think it's fair to say that we did learn as we went along, and a lot of things were picked up early on. So some of the learning is probably already in there. I think that similar to Shiraz's comment, really, I think there's some things in there that happens as a result of things that were outside of our control. So as disappointing as they were around things like suspending quality visits, etc., there were certain things that we really had no choice in that immediate start of the pandemic. So it's just important to reflect that back. But on the whole, thank you for the report, and I think it does highlight an ongoing discussion, and the fact that it will be an ongoing discussion, I think, is really helpful.
And Councillor Doherty.
Thanks for the report, Andrew. And I'm probably picking up on Andy's point. I'm sort of sat here thinking about all of the time that's gone since the report and all of the learnings that we've had since then as well, but also some of the national learnings that are coming out, some of the stuff, reports that we're seeing around mental health, etc. And I'm just wondering how we pull all of this together, because obviously I know here in West Berkshire Council, we're looking at OSMC are doing a piece of work to look back on review our response to the COVID pandemic pandemic, but obviously there's partners around the room. So I'm just sort of thinking, how do we pull all of these elements together to make sure that we have a comprehensive learning piece, but also a realistic learning piece with as many voices in it as possible? I'm just thinking how we pull all of this together, because I know as a council we're looking to do it. I know sort of from CCG, and there's elements in that report I recognise, and I sort of think, yes, that there are elements that have improved, and there's other elements I think I wonder what will happen next. So I'm just sort of probably looking to you, Chairman, to how we actually pull all of this together, and at what point we pull it all together as well, conscious that we're still responding. We still have that element of response. People are still going through this. So how we, as West Berkshire, look at that here is my question, really.
Indeed, and I'll come back to that when I close up. Councillor Stewart.
I thought it was an extremely interesting read, Andrew. Thank you. There were some topics in here that you mentioned, dentists as one of them. I see a lot of conversation on social media all throughout the pandemic, and still ongoing actually, about how can I get an appointment with a dentist and that sort of stuff. So it's really good to see it picked up here, and I hope that this will mean that actually something can help to sort of start to address that situation. And I also really like the fact that you've got some of the good news stuff in here as well. So the, thank you to, and Birdwood surgery is mentioned, and it's often mentioned in really lots of positive ways. And I think that was really, really useful to give, a really balanced view of what's gone on. So I just wanted also to say thank you to Healthwatch for producing this.
Thank you. And Andrew, I'll come to you to wrap up in a moment. Don't see anyone else. So I'll just say that yeah, I think I recognise that there is learning, and we need to ensure that either we have learnt or that we learn. Clearly, this is a first wave report. I think we need to understand where we are almost now, but in a couple of months' time, as restrictions are lifted, and there will be a learning curve out of that as well. Let's be under no doubt that we will need to learn what happens with the vaccination program as against the change in restrictions as we move to a perhaps more travel and other things of society. So whether it is the time now to reflect and start that piece of work that Councillor Doherty referred to, I'm not absolutely certain. But I think what I would look to Healthwatch for is further reporting and further survey and further knowledge as to what the attitudes of our population are to second, third, for whatever wave, and more, and as much to the relaxation of restrictions as anything. So I think it's an ongoing piece of work that we will need to come back to. Andrew.
Thank you, and thank you for the comments. That's very kind. I think the things that really keep, having read this a million times, and also some of the comments, I think we have some stuff we can actually action. So Hugh O'Keefe, who runs NHS Dental South, has very kindly agreed to come and talk to whoever in West Berkshire, if only for an update of where they currently are. I note from long-term planning that one of the recommendations we sort of hinted at with who actually controls NHS dental in local areas looks like it's being taken up at an ICS level. So I think that's really positive, because I think what we were finding was we found lots of pressure on this, but anytime it was mentioned through our usual channels, we kind of got this, well, it's not us. And although that it's not meant to sound flippant, the problem is because people were so busy, if it genuinely wasn't them, it almost just got knocked off the radar. And to have people, in pain with root canal and all sorts of other things, having to wait months and months and months, and for health and wellbeing boards to say, well, it isn't us, just doesn't seem right. So I think those are the sorts of learnings where we've also got to learn from, occasionally national government may not get it right, and can local adjustments be made? I didn't realise at any point that the planning team might almost become as important as the ICU team in terms of when we go forward and we're planning new estates and things like this, and ensuring that should a COVID wave reoccur, or as Public Health England point out in their response, the actual flu pandemic that we were expecting turns up. So I think it's starting to relook at our system in a very different way as well, taking on all these learnings. And I absolutely agree there's some work to be done. Really, really important piece we highlighted with Healthwatch England about the people who do not attend, which is a real problem for the hospital, who are currently massive numbers, but still with people not showing up. And we need to work out, why don't people show up? Has COVID instilled a long-term fear? And things that we touched on, like the workforce that Shiros mentioned, is, if you bear in mind, we had the public worried about the health and social care workforce, and that was before the second wave happened. So that kind of burnout, and just we're asking people to do impossible things. I think looking at things like Health Education England, taking some of the young people who may have lost jobs in different areas and saying, look, health and social care is a long-term proper alternative. So for jobs that may or may not come back, it's not for everybody, but you start to actually look at the breadth. And when you look at how Marmot works and things like this, you start to say, well, if you want to be employed your entire life, come and work in social care. You will never be unemployed in West Berkshire. But it's how we sell that and how we market it. So there's lots of partnership work here, but I think we have to be brave, and we do have to have this open loop, and we have to build back better, fairer, and make sure we're better prepared. So thank you, everyone.
Thank you, Andrew. Members, so that item was for noting, so there is no vote to be taken. And I therefore now want to move on to another item that is not for voting, which is the ICP update. And I think that is the other Mr. A Sharp, Andy.
It is. Thank you, Chairman. Please just bear with me for a second while I just share my screen for the presentation. Okay, so this is an update from the recent meeting of the ICP Unified Executive. So this is the progress of the work we're doing around the ICP across Berkshire West. There were 3 substantive items that we talked about at the last Unified Executive. One of them was around a flagship programme, which I've presented to this board previously, which is around joint commissioning and how we can work differently across Berkshire West to commission in the sector to get better value for money, but also to improve outcomes for residents who are accessing services that we are commissioning either through local authorities or through the CCG. So this is one of the flagship projects for the ICP over recent years. The report that came through to the Unified Executive was the outcome of a piece of work undertaken by our market management lead to look at the scope and scale of opportunities to change how we operate in the residential and nursing market in the light of the pandemic that's taken place through COVID-19 and the changes to the market. So the discussion at the UE identified that there were limited opportunities to take forward the joint commissioning agenda based on the fact that each of the organisations' local areas had different priorities and different pressures. But there were 2 key areas of focus that the UE agreed to take forward into further programmes of work. So one is around development of a joint nursing care strategy for Berkshire West for the 3 local authorities and the CCG. And this is about the purchasing of nursing care in the residential care market for older people. So we all face challenges with the number of nursing beds available in that marketplace. And the costs associated with those nursing beds. So we've agreed that we will develop a joint strategy for how we will grow, shape and commission in that marketplace. We've also agreed to undertake a programme of work around joint funding. And this was referred to in the response that Nikki gave to a quick question earlier in the board. We currently don't have a framework for joint funding across Berkshire West for health tasks that are being delivered through social care. And this interlinks and interfaces with continuing healthcare, although it is subtly different. This is about health tasks that are above and beyond social care, but don't cover within the CHC framework. So that piece of work is going to be led by Nikki, supported by the local authorities, and will be undertaken over the coming months. So those are the two key areas that the Unified Executive agreed to take forward as an outcome from that piece of work around the flagship project around joint commissioning. We also discussed the future flagship project. So the work of the UE needs to move on. There's been a process undertaken over the course of the past couple of months around identifying what potential projects we would like to take forward over the course of this year and into next year. Through an exercise of understanding what the priorities are associated with a whole host of projects that were put forward by various different organisations and boards that meet to support the development of health and social care across Berkshire West, we've identified this range of projects that we'll take forward over the coming months. So there's a piece of work around cardiovascular disease prevention, particularly around health inequalities, that will be taken forward. There's the Aging Well programme, emotional health and wellbeing for children and young people. This is particularly in relation to the emerging issues through the pandemic and the impact on people's mental health. There's a learning disability and autism piece of work that we want to take forward. There's also work around prevention, which is the Berkshire West CAN project, which is a current flagship project, which will continue into this current programme of work, as will the existing flagship project around rapid discharge. So this is ensuring that people are moved out of hospital as quickly as possible, back to home or into a more community-based setting rather than being in hospital for a long period when they don't need to be. So those are the programmes of work that will be fleshed out over the course of the next month before we meet again as a unified executive to understand the detail of how that will be delivered and what the outcomes will be. And those programmes will then be managed through the unified executive and potentially additional resources allocated to make those programmes happen over the course of the coming months. The third issue that we talked about with the Unified Executive was around the ICS footprint. So you'll be aware that there are potential changes to the ICS footprints across the country to make them more coterminous with boundaries of organisations that operate within those ICS footprints. There is the potential for the Frimley footprints, therefore, to change. And that might mean that they require a new structure for the ICS arrangement. So that does have potentially an impact on the current Bob ICS footprint, which is the one that Berkshire is part of. So there was a general agreement at the Unified Exec that if the Frimley arrangement were to end and they needed to change their footprint, that we would support the development of a Berkshire ICS, which would obviously change the footprint that we will be operating in as well. It's important to say that no formal decisions have been made. This is about how we interface with the wider engagement around potential changes to ICS footprints that are currently taking place. Obviously, this is a standing item as part of this board, and I'll provide further updates on the work of the projects that were identified in the previous slides and also discussions around the ICS footprints at future meetings. But those were the key elements that we discussed at the most recent UE to provide feedback to the board. And I'll stop sharing at that point.
Thank you, Andy. And I would certainly endorse that we live in those interesting times of ICS footprint, because the difference between what might be Thames Valley Bob Thames Valley ICS, I apologise, which I prefer. Someone said the other day that Bob, they didn't like the acronym Bob. I think Bob's a great acronym. I think actually, if you want an acronym for something, what could be better than Bob? And so a true Bob, i.e. Buckinghamshire, Oxfordshire, and the whole of Berkshire is quite interesting, but it's pretty big. And the concept of a Berkshire ICS, which I know officers tend to prefer, and I've learned to be guided by officers on these things, is also an interesting concept. So if Surrey goes ahead as an ICS, that will have a knock-on effect across the piece. Andrew.
Thanks for the update. I think the ICS update is particularly interesting because when these monoliths were originally forming, I seem to remember that Berkshire West was very keen to sort of head off with Frimley, and from what I know of shared services, etc., that would make the most sense as of today, but then who knows where we'll be tomorrow, in just terms of integration, because Oxford and Bucks have got a history of working together. They share mental health services, etc. We don't. There's some brilliant practices going on in the east that we're looking to bring over into the west. There's lots of co-synergies along the M4 corridor. So I'd be very interested in potentially finding out as much about that as we can. The other quick one I just wanted to touch on, and we've touched about the thread of this throughout, is workforce challenges, which although I was in the second meeting, didn't really make it through, but I know is a key factor for absolutely everybody involved in health and social care. And Steve McManus highlighted this last year from Royal Berks about we need to stop pinching each other's workforce or losing people to Aldi, having trained them up to, you know, huge extents of professionalism, that if people need a change, we can potentially swap them from local authority to health or general practice to A&E or the other way round. I think those are sort of, again, the transformative things. So I'm really keen that the UE doesn't lose the workforce pressures, because that seems to have such a knock on in everything. And I think sometimes everyone always assumes someone else is dealing with it. And I think it's a really cool one for the board to do. Thanks.
Yeah, Andy, please.
Thank you, Andrew. Yeah, you're absolutely right on the issue of workforce. One of the things that we absolutely talked about at the UE was the fact that we need to have a greater focus on what we would call the enablers for the flagship projects, and the workforce element was certainly one of those. So it will be down to the delivery group that sits underneath the UE to manage how that is delivered across those projects. But your point is absolutely well made, Andrew, that workforce is critical to delivery around all of these. And that joined up approach to how we manage the workforce development is absolutely important. So that'll be picked up through the delivery group rather than the individual projects, but it will make sure that that span is considered. So thank you for that.
So members, anything else anyone wants to raise? I see no hands. So that was simply a verbal report from Andy as to current position, and thank you. So we now move on to a paper which will have a vote at the end, and this is engaging and enabling local communities. I've had some involvement in conversations on this with Sam Shepherd. So Sam, would you like to present?
Thank you, Chairman, and good morning, everybody. I'm not sure I've had the pleasure of meeting you before, and certainly not in this forum. So just briefly to introduce myself, I am Sam Shepherd. As Councillor Bridgman has already said, I am the Programme Manager for Engaging and Enabling Communities with West Berkshire Council. I have been in post for about 10 weeks now, so relatively early days, and I sit in terms of structurally with Susan Powell and her team, so have some close links with the good work that's already been going on in West Berkshire before I arrived. So the paper in front of you today is here really to help describe a way of working for delivering the board's priorities. There's clear strategic alignment between engaging and enabling communities as a concept with the health and wellbeing strategy that the board has already agreed this morning. There is also alignment with the council strategy and its ambitions, as well as the recovery and renewal plan that the council has recently refreshed, and a communications and engagement strategy that the council agreed back in the autumn. So this is really seeking to understand the community connections and support those community connections that help everyone in West Berkshire shape thriving communities and create local solutions to challenges. So this embodies a number of sentiments really about inclusion, about health and well-being, also about the kind of wider determinants of health and those community connections that help support those. It also really wants to look at all communities. So we are talking about communities in this context as the seldom heard groups. It's also about our voluntary and community sector, our towns and parishes, and those community groups that have so recently mobilised through the pandemic. So what this programme of work is doing really is about a shift in the way of working. The slides that I circulated with the papers today describe some benefits for each part of our communities and what that might mean for them. And you'll notice in those slides that it's quite a kind of qualitative relational type of benefit that we're seeking here. It's about a different feeling. And that's quite difficult to quantify, but we certainly will be seeking to quantify that through asking individuals about their experiences and their lived experiences of inclusion and a feeling of connectedness and satisfaction too with the relationships that we have with statutory partners. But we're also seeking a quantitative change in outcomes. So we are looking for to support this board in everything that it's seeking to achieve around health inequalities, for example, but it's also about equality around economic outcomes too. So this, as I said, this is a way of working, and the slides that have been attached do outline a couple of case studies. So there's one in there around how working together with communities has been done in Oxfordshire around co-production in adult social care. There's an example in the slides too of how co-production in the use of a social value policy has had some successful outcomes in Bristol. And there's examples right here in West Berkshire of how community conversations have been undertaken to make a shift in the way that we relate to communities. You'll see in the slides that I've described the governance, proposed governance for this way of working, and there is an internal governance arrangement that the council has with its Customer First Programme Board, where it very much is focused on our external stakeholders. So there's a natural home for this work under that and under the comms and engagement delivery angle. But there is a really important part of this work that is about how we work together as stakeholders, all seeking to deliver improved health and wellbeing across West Berkshire. So you will see in the papers that there is a suggestion that we have a community alliance under the governance structures of this board that would be seeking to have both the voluntary community and statutory sector colleagues contained within that in order to really, I guess, take forward the lessons that we have learned through COVID of just how important it is to bring together stakeholders that can hold the keys to unlock solutions. And we want to do that in a way that embodies the spirit of engaging and enabling communities and co-produce and co-design what that community alliance should look like. So what I can't do today is describe to you an exact terms of reference, but it would be seeking to be a board or a group of individuals who really can unlock those local solutions. They have at their disposal the resources, whether that be in volunteers, whether that be in funding, or indeed in being able to access other types of resources to make a difference. So that community alliance is a proposal that I bring to the board today. I also recognise that that small tight group of individuals in a community alliance needs to really reflect upon a much wider view. So there is a proposal in the paper today that we have a stakeholder forum that would be looking at a much wider scale around community and voluntary sector engagement so that we hear the views across that sector. So my ask of you today, Health and Wellbeing Board, is threefold. First, could I seek your support for the vision for this programme that is contained within your papers? Could I seek support for the establishment of a community alliance as a concept, recognising that the final format and form of that needs to be co-designed? And indeed, the support for an introduction of a stakeholder forum of some kind that would gather the views of the voluntary and community sector. Thank you.
Indeed, and thank you, Sam. As members will know, I chair the Community Support Hub, and so I have some thoughts on this, but I'll leave those till the end. I also chaired a meeting in which some on this Zoom meeting were in to introduce EduCafe to the council, and that has a role to play, I think, here and link into this, but I'll mention both of those in a moment. So before I do, members. And there was silence. Oh no, Matt, off you go.
No, it's just to thank Sam, but also just to reinforce, I think, what I've already said. I think this is a really fundamental element of how we improve health and well-being across the district. It is a fundamental change in how we work with our communities and how we engage with our communities. And again, it's another one that will take time, but it really is about not doing to, doing with, listening, really understanding those needs, not just looking at the data. So I'm really excited about this piece of work. I think it's going to make a big difference, and I think we've talked about this for some time, and there's some really good practice elsewhere, so I'm hoping we can draw on that. And again, it just links to everything we've talked about, I think, today, whether that's listening as part of the pandemic response, or it's about listening as part of health inequality. So I think if we get this right, I think it could be something that, yeah, is really exciting. Thanks.
And Councillor Doxey.
Very unusually, I'm going to disagree with Matt in the fact that actually I think this builds on the work of the Building Communities team and the work that we've done as a priority as a health board over the last sort of 4 or 5 years, where we've been looking at more and more having those conversations with people and understanding what the need is rather than us imposing the need, and very much agree with Matt that working with people rather than doing 2 or 4. So it's something that I feel really strongly about, and I think this will really help. I know we sat down, I think it was an informal board meeting where we looked at things like the Wigan deal, and we talked about how do we take these next steps, and for me this is taking these next steps, so actually doing something very concrete about this and moving it forward. And I know the Health Watch report talked about lessons learned from COVID, and for me one of the key lessons learned is how we harness and work with those community groups that we've seen come up within I think it's over 90 community groups we've been working with over the last year through the Community Support Hub, for how the partnership of the Community Support Hub work. It was an alliance between Greenham Trust, West Berkshire Volunteer Centre and West Berkshire Council, how we actually sort of carry on and project that going forward so that we capture the good work that has come over the last year and we drive that forward to make sure that we're really engaging. And I was, it was my paper that was the communication and engagement strategy that went through executive last autumn, and I feel really passionate about this piece of work, so I'm really happy to see this here. Welcome Sam on board. It's great to have somebody to pull all of this and drive it, and I think we've got the right person with Sam, so really keen to see these recommendations go through today, Chair.
Yeah, and of course, as usual, she's stolen most of my words, but there you go. Andrew.
Yeah, I'd like to agree with Councillor Doxey and Matt. I think they're both right. Because you evolve into stuff, but sometimes you've got to take quite a decent sized leap, and I'm hoping this will be it. All the stuff we've talked about this morning will start to lead into this, and I think if we can start being absolutely proactive and looking at all the non-medicalized stuff and joining the communities in, because our communities did a remarkable job, and you actually see once they're sort of up and running, they really don't need much help. And what we highlighted in the report was, let's not lose that enthusiasm. Let's go re-energize them and give them meaningful things to do. Because as a parish council member, much as though dog bins and footpaths are desperately exciting, you do sort of feel for your community. You could do, lots more, and the pandemic gave lots of organizations like that the chance. So and I agree, I think Sam, perfect person to do this. So more, faster, yeah, let's get on with it. Thanks.
And I'm now going to exercise my chairman's privilege to invite someone who is a substitute on the on the board, but since I'm in the room and he's my substitute, I'm going to let him speak. Councillor Jones.
Thank you very much, Chairman. I appreciate that privilege. Just to say that I think I desperately support this recommendation as well. But I think if we talk about things like inequalities, engagement with communities, we're talking about really, really tough stuff. But it's exactly what the Health and Wellbeing Board should be about. It's very local, but it's going to make this sort of stuff. It's going to make a huge difference to the local population. And so I very much endorse that and the inequalities work that was going on earlier.
Thank you. See no one else wishing to speak, so let me wrap up. Unless, of course, Sam wants to come back on anything, and I'll give her an opportunity in a moment. I think I reflect that having chaired the Community Support Hub for a few months now, and having been involved in it from its inception, what has happened is that we have seen this vast upsurge of community involvement as a result of the pandemic. So it's a tragic way to find that linkage into the communities, but we mustn't lose sight of it. We need to build on it. We need to work with it. Work has been done. Work is still to be done. So I am absolutely in favour of the recommendation. So before I move to the vote, Sam, is there anything you want to come back on?
Thank you, Chair. I would just add that work around how we harness that community spirit and maintain it has already begun. And in fact, just yesterday, Sarah Rayfield led a meeting of community groups where we were discussing proposals for having health and wellbeing ambassadors. So that's just a really tangible example of how we are really trying to make sure that we don't lose that mobilisation and that engagement that we have right now through those incredible groups that have stood up through the pandemic. So I did just want to offer that as a very, very clear example of how we're already seeking to make this happen.
Thank you, Sam. And I would certainly say that whilst Sam has not been here very long, she hit the ground running. Members, we need to propose and second the recommendation, which is at item 2 of this item. I won't read out that, as Sam has already referred us to the 3 elements she's seeking agreement on. I won't read them out again. They are on page 155 of the pack. I will propose from the chair. I see Councillor Doherty has a hand raised to second. So I will now move to an indicative vote of the full membership for agreement to these 3 recommendations. All those in favour, please raise. And anyone who is against, and abstentions. Andrew, thank you. Right, members, I'll now move to those in the room for listening and having watched that indicative vote in favour of the 3 recommendations. That is unanimous. Thank you very much. So those recommendations are adopted. Right, members, we now move to look at the forward plan, which is in your pack, I think, and really just to note it, and that I suggest that if anyone has any detailed changes they think should be made, they email me and copy Gordon. That seems to be the easiest way of dealing with, a fairly, it's not complex, but has a number of items on it. And I don't think it's discussing it now won't assist us. If we do have anything we think is in the wrong place or needs to be inserted, please email and we'll take those questions, those issues on board. And please note that there is a workshop proposed for the 24th of June, and more details about that will be coming out to you in due course, no doubt. Gordon, he nods. Thank you, Gordon. Right, item 16 on the agenda, unless anyone had anything to say about the forward plan. No, I see no one wanting to speak. So we now, I don't think there are, but Gordon, can you please confirm that we haven't had any member questions?
That's correct, Chairman. We haven't received any questions today.
Thank you. So now we have matters which are for information only, so we don't need to speak to them. They are item 17, which is a COVID situation report, which has gone to LOEB, and obviously there will be further reports to Local Outbreak Engagement Board, and indeed there is constant information on the Berkshire Public Health website. And as we discovered a couple of days ago, I think from Andy, there is now vaccination information on the government site as well. So there is daily vaccination information going up. Item 18 is the housing strategy. Just to note the strategy and that it was adopted at the executive on the 25th of March. Item 19 is the Tobacco Control Alliance plan for 21-23. Now, in fact, that plan falls under the PPP to deal with, but we are asked to note the plan and indeed note and support the delivery plan. And then item 20 in your agenda is future meeting dates. Well, you have those, and obviously you will receive invitations in the fullness of time. Quite how we, the next one, 22nd of July, will be after we all hope we will be out of lockdown. So we should be back to a physical meeting, but we will be seeking to stream that meeting. So details of how we intend to stream, because in order to stream in the way that we're doing it now, everyone will need a camera, and therefore you'll need a laptop or some beast with a camera to take your image and put it into Zoom. I think that's what we're going to work towards, but there's lots and lots, and let me assure you, there are lots and lots and lots of discussions going about this, and I'm fully involved in the process. So we will see where we go to with that, and you'll all be told how we're going to progress. So with that, I am going to thank everyone for their attendance. I'm going to close the meeting, but I'm going to ask everyone to stay in the meeting until Kevin has confirmed that the streaming has ended.